Okay, so today's topic is the impact of isolation, and I would include loneliness on mental health, with a focus being on those who live and work in our rural areas. This really um, came to my attention. Like, we know it exists, right? We know that we have clients or patients or people we work with who are struggling, who are reporting feeling lonely and isolated. Um, However, when it really became, I guess, real to me, the extent of the issue was when I was made aware of the Surgeon General's advisory that he just released last spring. It was either in March or May of 23. And it was all around kind of this epidemic level of loneliness impacting adults in our country. So this is just a little segment from his advisory. And it is even before the onset of COVID-19, the COVID-19 pandemic. Approximately half of US adults reported experiencing measurable levels of loneliness. Half. So there's, let's see, how many of us on? 77 on this call. So nearly 40 of us in any given year have reported experiencing measurable levels of loneliness. When it says measurable levels, to me, that really means it's impacting our functioning in some way. Disconnection fundamentally affects our mental, physical, and societal health. In fact, loneliness and isolation increase the risk for individuals to develop mental health challenges in their lives. And lacking connection, get this, lacking connection can increase the risk for premature death to levels comparable to smoking 15 cigarettes a day. That is what really just stuck with me, that when we look at the impact of isolation and loneliness, the premature death rates associated with that, with lacking connection, increases the risk comparable to people smoking 15 cigarettes a day. That was astounding to me. And it made me really want to dig in deeper, like how did they come up with that number? How does the risk become apparent in someone's life? What are those risk factors that are leading to those kinds of levels of premature death? So I really used this advisory as a jumping off point. And I think also it's really important for us to point out that the Surgeon General started his work on this pre-COVID. So I want to say the initial articles he was writing and the initial research that was happening was in 2017. So when you think about how much COVID exacerbated isolation and loneliness, it's really astounding. So just keep that in mind as we move forward and look at some of the statistics that came out of the Surgeon General's report. But first, I just wanted to talk a little bit about what I see when I'm out and about doing my work. And then I'd like to hear from you guys in chat or unmuting about what you see in your work that indicates people are feeling alone and isolated. So what I see is loneliness and isolation impacting people across all ages. And again, I work with our farmers and ranchers and their families. So that's kind of my population, right? That's who I'm interacting with, what I see. And I see from children all the way through our elderly population reporting some level of feeling isolated and feeling lonely. So across ages. I see a geographic isolation. So people who in our very rural areas are disconnected geographically. They're not seeing other people. They're not interacting with people. They're not getting together with groups of people. Some are not involved in like a church type setting or community groups. So they are very rural geographically, which adds to isolation and loneliness. I see our rural folks working very long hours, which many of us interact with people in our work. But again, we know that's very different than having connection. You might be connected with people at your work, but you might not be. So being around people at work doesn't necessarily guarantee that you're not feeling alone and isolated, right? Many folks in our rural areas work in isolation. They are solitary. They're working on their own. I see the amount of travel that folks are having to do when they live and work in rural areas is adding to their isolation and loneliness. That they're spending hours in their vehicles, not connecting with people, and often that extensive travel wears them out physically, mentally. And so when they do arrive at home, at work, or what have you, they're tired and they're kind of seeking solace or rest. Another factor I see related to isolation and loneliness in our rural communities is weather. And I mean, gosh, this past week has really um, made that evident, that the cold, the road conditions, the blizzards, the blowing snow, it keeps people from going out and connecting with others. It can be very, very isolating. I talked to one of my clients who lives in rural North Dakota, south of Jamestown, yesterday, and she was talking about her electricity was out for like a week after it had rained and then froze in the ice. And so she didn't, she hooked up the generator and kind of hunkered down and didn't go anywhere. So very lonely, very isolating. The next one is very specific to our ag providers, that what I hear from them, and I know this is for other groups too, and other cultural groups, that there's a disconnect with understanding the lifestyle. So people around them not being competent in their lifestyle. Healthcare providers they work with, behavioral health and medical, not understanding or being competent in their culture. And so there is a disconnect. Like, I'm living this life, I'm doing this work, and nobody gets me. Nobody understands the pain, the struggle, the dedication that I'm putting into life. Another piece that I see that adds to this issue is in rural areas, our lack of broadband connection. That in many, we lose sight of this when we're working and living in a place where this is not an issue, but it is still a big issue in many, many areas. And some of my clients, I drive, 2.5 or 3 hours to meet with them in person, because we could never sit and have a session virtually. Their connection is just not good enough to even make that happen. So that can also be a very isolating factor. And then general lack of diversity or experiences in rural communities. I have had a couple of farm families where the next generation, the young adult, has been considering coming back to the farm. However, they feel a lack of the general lack of diversity in the community. It's very unwelcoming to them to come back. And if they've come back, they feel very lonely and isolated. So sometimes if our rural communities don't offer those rich experiences or diversity that larger communities have, it can really be tough for people who are working and living there. So those are just a few things that I see related to the impacts of isolation and loneliness for folks. Go ahead and share what you see. So we've got, and if you want it to be anonymous, just send it like to me or hosts and panelists instead of to everyone, and then I won't read out your name. We've got Heather sharing students making poor choices on social media, turning to virtual reality games, and disengaging from real world situations. Absolutely. And I think even adults, right? We sometimes disengage from people around us, and we are scrolling, we're not interacting, and it's really kind of a vicious cycle that can draw us in. Thanks for that comment, Heather. Others, what do you see related to your clients or yourselves? What is adding to isolation and loneliness? So someone commented, politics can be isolating if you don't hold views of what you think the majority are. Absolutely. Absolutely. Sometimes in our rural communities, it's very clear, what the majority is. So if you don't fit with that, where does that leave you? Asia shared addiction and dealing with physical disabilities. Yes, low income and lack of transportation. So many barriers, right, that can add to disconnection and loneliness. Callie shared people, both youth and adults, lack coping skills as well today. We buffer or turn to other things when things are hard, such as food, Netflix, scrolling, alcohol, instant fixes for a short period. Yes, yes, yes. It's hard to open up and talk to people and work through things, right? But when it comes to coping skills, it's the healthy thing to do. Okay, Ashley shared students coming to college from different states and countries and are isolated from their families. Yes. I had one student say he was very isolated over Christmas break. So true. I see that a lot on farms that employ immigrant labor. So most of the folks are coming from, Mexico, or they're Hispanic, and family and family relationships are one of their greatest coping strategies. And here they are separated from family and very isolating. All right, Lorelei, I hope I'm saying that right. Lorelei shared the ruralness of North Dakota and the lack of transportation. Yes. I'm just going to talk a moment about that statement, the ruralness of North Dakota, made me think of this. When I do QPR, question, persuade, refer trainings on suicide prevention and intervention, one of the slides that's shown, and I should have put it in the slide deck, but it shows the states with the highest levels, highest rates of death by suicide. And then the question is posed, what do these states have in common? And the states that are the highest with rates of suicide is like Wyoming, Alaska, Idaho, Colorado, I want to say New Mexico. And what is in common is the absolute geographic isolation or loneliness, which then equates to a lack of workforce and a lack of services, increased stigma. I mean, there's a lot that goes into that, right? So rural is definitely a barrier. Okay, Ashley shared some don't know how to initiate conversations with others. Yes, some people isolate. And sometimes I I even hide behind that, like I'm an introvert. And that's okay, but you know what? Even introverts need connection. And for those who struggle with community or initiating conversations, that's hard. Okay, Amber commented senior citizens living on farms who can no longer drive and have no transportation. Absolutely. We have an aging population in our rural areas, and many of them are very alone and isolated, um, even if they're in town, but definitely if they're out in the country. Weather gets bad, they can't get out, um, family's not always around. Huge issue. And another piece related to this, when we look at suicide rates, the rates in our elderly ages 74 and up are the highest of any age group. And much of that is due to isolation and loneliness. All right. Iris shared lack of connection in the classroom, low tolerance for diverse views. Very true. People are kind of siloed. Okay, Emily shared, prior to my current position, I was working as an addiction counselor in a small Minnesota town, and my clients struggled with finding various sober activities due to not a lot going on. Alcohol was used everywhere in town. Yes. Many had their licenses taken away from DUIs and didn't have a way to get out of town or go anywhere. So true. And what I see is in many of our rural communities, the bar, the local tavern is the connection point. So for people, and I've had a few clients who have, gone to treatment and have returned home and are working to live in recovery. And what that means for them is like their social network has decreased by about 95% because their social network was at the bar or at events where alcohol really is central. And so sometimes they're able to do that, and sometimes it just does not work well. We have another comment, trying to find mental health support in a rural setting, really tough. And you guys know that you're living that world, right? Where some of you are it in your community. Some of you aren't even maybe mental health workers, maybe you're public health nurses, but guess what? Mental health becomes your thing because it doesn't exist in other organizations in your communities. It's tough. Then Vanessa commented, as it is filling our gap for our rural needs, which is so helpful to disconnect by just doing things via online. Yes, the telehealth, Teams meetings, Zoom. You don't get to see and talk to people anymore in a physical face-to-face connection. And just think about that these stats I'm going to give you from the Surgeon General, that was pre-COVID, before we really went big with telehealth, Teams meetings, Zoom meetings, and think of how that has grown in our lives and that much more exacerbated feelings of disconnection. Oh, yes, Lorelei, we are very proud people and feel we can do it on our own instead of asking for help. So picking yourself up by your bootstraps, there's a lot of pride there. But you know what? That's part of the stigma, right? In rural areas that keep people from connecting and being vulnerable and opening up and talking. And Jared shared the romanticism of living off grid, like on the TV shows. Sure. Yep. And then like avoiding certain groups or cultures due to our perception that they have a mental health diagnosis. Yeah, that can really lead to isolation and loneliness. Really good comments, you guys. Thank you for sharing. Another one that comes up fairly often is areas that have military base, that you have people that are deployed and away from home and they're stationed. I don't know if deployed is the right word, but they're stationed, like in Minot, for example, or they're working out in the oil fields and they are away from home and they don't get to see family. And that can be same with college, being a college student. Um, you're away from your support system. Well, thank you for that. That was a great discussion. So let's jump in a little bit more to defining isolation and loneliness. So some synonyms that go along with this is solitude, which is very interesting, and we're going to talk about that later. Feeling lonely, secluded, withdrawing from others, separateness, just this feeling of like, I can be in a group of people, I can be surrounded by people, but I feel very alone or separate. The absence of connection, which a few of you commented on in the chat. And Ashley shared there's been a significant increase in suicides on the Minot Air Force Base. Incredibly tragic. All right. So when we compare, like I'm using isolation and loneliness kind of interchangeably as we dive into this issue. So I just want to tweak it out a little bit, where social isolation is the absolute lack of social contacts and having few people to interact with regularly. So again, you could be in the middle of a group and not be connecting with these people in a way that's meaningful. If you have social isolation and geographic isolation where you are physically away from people, that adds to the level of impact. And then when we look at loneliness, that is a feeling, that is a just distressing feeling of being alone or separated. And that can be physically, mentally, emotionally, spiritually, that we are feeling this sense of loneliness, even if we have people physically around us. Okay. So potential causes, lots of causes out there, and we jumped into some of those with our chat discussion. But some of the more common is that someone lives alone, like we talked about with our elderly out in rural communities. A change in living situation, so that could be even a college student going from home to the dorms or back to their college town. It could be the scenario we shared about military, where they're moving and changing, so you don't get the chance to build up kind of your group or your people or your team or tribe because you're physically, geographically moving. Lack of close connections, that can go back to the one comment about some people just due to how they're functioning in life socially, maybe their confidence level, they struggle to initiate conversation. And I find that among empty nesters, so kind of middle-aged adults, kids have left home, the connections that they had established were around their kids' events and activities, and now that kids are gone, there's a general lack of like, I don't have my people, and how do I make friends now? Or following a divorce where there's, maybe there were couple friends, but there's not couple friends anymore because we're split up. How do I make new friends as an adult? That's tricky. Poor physical or mental health, which often keeps people secluded. The death of a loved one, and financial issues. And when I see my folks that have significant financial issues, their feelings of isolation, a lot of it is around shame that they are struggling financially. It's around not wanting to appear vulnerable by sharing their situation. And so they really withdraw internally and are not reaching out. Other causes, things that come to your mind that really point to, what, this is a situation that I've seen people being very alone and isolated, and this is kind of the cause of it, or this is what their environment looks like. We covered a lot of this in chat, but anything else that we haven't brought up? Go ahead and throw it into chat if you would like to, and we'll keep marching forward here. Hope we have one. The weather. Yeah. It's kind of crazy, isn't it? How isolating that can be when we've got the storms and roads are closed down and we can't get out and be with people or go to church or go to games or interact. Hugely isolating. All right, we'll keep going. So what does loneliness feel like? It can feel different for each individual may experience it differently, but typically it's going to kind of mimic symptoms of depression, those feelings of sadness, emptiness. I'm just not comfortable in my own skin. I'm left out. I'm not being included. I think especially for our young people, when they have, their social media access and they see other people are interacting and together and doing things and I'm not, that's hard. The longing we have, almost like a spiritual longing for companionship and connection, feeling like you're misunderstood or not heard. People don't get me. They don't get what I'm trying to say or who I am. Feeling isolated even when you're surrounded by others. Or, interestingly enough, feeling exhausted or burnt out by social interactions, which alludes to the fact that they are not, I would say, in depth. They're more like surface interactions. So there's still that feeling of loneliness because you're not getting, you're kind of not making that heart to heart connection with somebody. It just wears you down. Oh, Chelsea, your comment goes right along with that. People are peopled out with the interactions they have to have during the week with work activities, etc. They want to stay isolated on the weekends for a break, but they miss out on interactions they want to have. So true. So true. So how do we balance that, right? So we're sure we're taking care of ourselves, because if we don't, if our only people interaction is around work and we're not getting that healthy connection outside of work, is the prime place for burnout to start to happen. Feeling insecure, something's wrong with me, people don't like me, people think I'm weird. I have a client who is a college student, and she was homeschooled, and so very little interaction with kind of the outside world. right? They lived on a farm in town or in the country, homeschooled. And when she went to college, it was really her first experience making friends and developing relationships with peers. And she felt so incredibly insecure. Like, I don't know, she had no idea how to navigate even like the basics of developing a relationship. So she was reading people constantly to try to gain security for herself based on their um, facial expressions or their interaction, because she didn't have that self-confidence. Okay, loneliness can feel like ruminating and reminiscing on the past. General decreased energy, insomnia or sleep problems, such as trouble falling asleep or sleeping more than usual. And I'll hear that from people, folks who are really feeling lonely and isolated. They feel like they'll say like curling up in a corner with a blanket and a book and just shutting the world off. And then withdrawal from social events, those very things that we want to believe will combat our loneliness and help us feel engaged and connected. But sometimes, again, if it's not on a level that's beyond social, um, and we're not kind of having those heart to heart connections, it can still feel very lonely. So this is a slide from the Surgeon General's advisory, and it talks about 3 vital components of social connection. So it's the extent to which an individual is socially connected depends on a lot of factors, including these 3 components. The first is structure. So this is kind of more like quantitative, right? The number and variety of relationships and frequency of interactions. So how many people live in our home? How many friends do we have in our innermost circle? What is our, do we have a significant other? Do we have a spouse or a partner that we have interaction with regularly? So structure. Then function is the second component of social connection, and that's the degree to which relationships serve various needs. So you can have these people, right? You can have the numbers, you can have people that you live with, you can have a partner or spouse. However, is there emotional support there? Do we have somebody who's a mentor for us or a go-to person? Do we have people that offer us support in times of crisis? And then third is the quality piece. So again, we might have the relationships, there may be people there for us, kind of serving our needs, but is there satisfaction or is it a strained relationship? Are we are we experiencing conflict in our relationships versus peace and connection? So when we are working like for ourselves and also with the folks we work with, these are things to kind of feel out with them. If you're anticipating that some of what's happening for a person is that they are really just lacking connection and that they're lonely and isolated, running through these 3 components can be helpful just to draw out from them who they identify as their support and what is the quality of the relationship with that support person. Because sometimes people will identify somebody and you find out that that relationship is full of conflict. And so it's not serving the purpose of good social connection. So structure, function, and quality. And I can send my slides out too after the presentation, if that would be helpful. We're going to dive in a little bit on some more statistics and just some general notes around social connection. So this again is from the Surgeon General's report. Really eye-opening to me because, and these are a little bit hard to see, so I'm just going to talk through them. So these were national trends for social connection. So this was information gained from people who were polled, surveys went out, research was done. So these started in the year 2003 and went to 2020. So no COVID years in these studies. The underlying message that came out of this statistical study is that time spent alone increased while time spent in person, socially engaged, decreased. So the first little box was social isolation, which increased 24 hours per month, with a big change happening around like the 2017, 2018 year. Really leapt up to 333. Then we have household family social engagement, a decrease of 5 hours per month, which seems somewhat low to me. I would have thought that would be higher, with us being on our computers and iPads and phones and such. People reported their level of companionship, time spent in companionship, decreased 14 hours per month. Social engagement with friends, look at that, decrease of 20 hours per month. Non-household family social engagement, so other family members that don't live with you, a decrease of 6.5 hours per month. And social engagement with others, decrease of 10 hours per month. So when you think about a month and think about really time outside of work and normal household duties, that's not a lot of time. So to see that these numbers decreased, and that's kind of our quote unquote free time, that's really significant. Any thoughts on why? I'm guessing I know what some of you are going to say, but thoughts on why from 2003 to 2020, we saw this kind of decline in social connection and increase in isolation and loneliness. What are some thoughts? Social media and technology. Yeah, increase in social media usage. I would agree. I think that's the core of it. I think it's working to keep people really isolated. And ironically, it's called social media, right? So we should be more connected, but it's not the kind of connection that is helping folks. Okay, and yes, Melissa, good point, includes all generations. All right, let's keep going here. So this is the slide that really gets to the gist of how they were able to ascertain that loneliness and isolation causes premature death levels that equate to people who are smoking 15 cigarettes a day. This slide really tells us why. And it's all about how social connection influences our health. And they propose, this is the Surgeon General's report, that social connection influences health through 3 pathways: biological, psychological, and behaviorally. So the premise here is that when we have good social connection, that our stress hormones decrease, we're not living in that stress response, so we experience less inflammation overall, that we feel like we have meaning and purpose in our lives. We feel more of a sense of safety. We feel like we have greater resilience when we have social connection, and there's hope for the future. And then behaviorally, people that are more socially connected typically have greater physical activity. They typically eat better, sleep better, smoke less, and seek treatment for things that they need treatment for, whether physically or mentally. So think of the flip side of this, that if stress is high, if we feel a lack of purpose and hope, if we are not taking care of ourselves physically, that really is the parallel to premature death at the level of people who smoke 15 cigarettes a day, through, suicide, through chronic disease, through obesity. And in the little outcomes box, you can see outcomes, negative outcomes, such as heart disease, stroke, and diabetes can lead to an individual's morbidity and premature mortality. So social connection, in essence, is a protective factor. And we talk about in life surrounding ourselves and helping our kids build protective factors and decrease those risk factors to help us be more resilient, to help us get through difficult times in life. That is exactly what social connection does for us. And the price we pay for not having it are all those negative health outcomes, which would also include suicide. So really important to look at the mind-body connection when we talk about our social networks and our feelings of isolation and loneliness. Any thoughts, questions, comments on this slide? This is what really made the connection for me, because when I read about the premature death rates, I was like, oh, okay, how do they come up with that? Like, what's the groundwork that leads to that kind of a research conclusion? And really, this just nailed it for me. I mean, it makes perfect sense. Other comments, thoughts on how social connection influences health? And even think about something as basic as when we go home. If our home is conflictual, if there's a lot of stress and there's a lot of tension, think about how that impacts us biologically, psychologically, and behaviorally. Versus if we go home and there is peace and people are able to talk calmly, to problem solve versus being emotionally elevated. Think about how that feels and impacts us biologically, psychologically, and behaviorally. All right. So additional statistics on physical health consequences of poor or insufficient connection. There's a 29% increased risk of heart disease, 32% increased risk of stroke, 50% increased risk of dementia in older adults, 60% increased risk of premature death, which we've talked about, and an overall increased risk for mental health concerns, specifically depression and anxiety. So here are some 6 findings about loneliness. And this came following the Surgeon General's report. And this was a doctor who wrote an article for Forbes. And so he took the information, the report, and he kind of drew out 6 of his top findings, because the report is like 80 some pages long. So I have the link at the end if you would like to check it out yourself. I did not read the whole thing. There's lots in there. But the 6 findings that Dr. Robinson pointed out, where is number one, there is a stigma associated with loneliness. People typically don't want to be known as lonely. And there's kind of, I would say, shame associated with being lonely. Like, I should not feel like this. I should not be like this. I should be doing something different in my life so I could be more accepted. So stigma associated with loneliness. Second, most people think loneliness is a feeling and haven't considered that it also has physical components to it. So it has that biological component, that psychological component, and the what am I missing? Biological, psychological, and behavioral components. Number three, loneliness can throw you into a cycle which perpetuates further isolation. And we've kind of touched on that, where when we're feeling lonely and isolated, we actually withdraw. We do the very thing that is keeping us feeling lonely and isolated. Number four, loneliness takes a toll on worker engagement. And this is something interesting. I just want to pause for a moment. So I do another presentation, and it's really around resilience and building protective factors. And one of the questions I asked via anonymous poll is the status of your support system. And I do this with, on webinars like this, but I also do it in workplace settings. So with a staff, and almost 100% of the time, someone indicates the last choice in the poll is, I feel alone and isolated. And everybody's kind of looking around like, oh my gosh, there's someone right here in this room in our midst who is reporting that they feel alone and isolated. So I just encourage you that, I know in our office settings, and sometimes we work virtually and we're not interacting with people, but don't lose the fact that there are people around you that, even though they might be showing up every day, they are suffering, and often suffering in silence. So it's kind of looking and watching. Are they engaging with others? Are they having meaningful conversations? Are they an appreciated part of our team who are interacting? Or are they kind of sitting back, disengaged? Okay, number five, there is a difference in solitude and loneliness. And we had the solitude word up early on in the presentation. The difference is that often solitude is something that we seek to help us calm. It's often something we seek to grow, like our spiritual protective factor. It's different than loneliness. So, for example, I typically twice a year go on a camping trip by myself. I'll hook up the camper and go. And people will say, isn't that so lonely? You're alone out there. Don't you feel isolated? It's like, nope, that is an absolute intentional choice I'm making to experience solitude, which refreshes my spirit. Very different than people who are lonely, and it may look like they're choosing their loneliness, but it could also be that they're caught in this cycle that's perpetuating further isolation. And then number six, media connections are not necessarily the same as deeper connections, or what I've referred to as like heart-to-heart connections. And we have talked about that. Many of you have put that onto chat, that social media and virtual connections, not the same. And Melissa commented, Glamorization of being busy and having lots of friends can be very isolating to those who don't want to be overly busy. So true. It's like it is glamorized that we're doing this and going here and having this experience and we're always with friends. And that doesn't always work for everyone. And there could be people who are posting all the things and glamorizing it, but are extremely lonely and isolated, although they're having all of this contact and connection. Let me see. Okay, Tammy, there should be more education about number 2, that most people think loneliness, yes, is a feeling, and haven't considered it also has the biological, physical, psychological components to it, behavioral components. Good, thanks for those comments. All right, so what do? We know all the things, we kind of realize the impact, how big the impact is. So that leads us to like, okay, what do we do? What do we do for ourselves? What do we do for the people we work with to start to combat this epidemic that has really taken over? And I've got to tell you, nothing I'm going to show you on the next couple pages is earth shattering at all. It's not going to be something like, wow, I never thought about that. This is going to be basic stuff that we just have to work really hard to intentionally implement for ourselves or help our clients implement, and even more importantly, teach our kids how to implement. And it's really around, I think Callie said this earlier, it's really around developing those good, positive coping skills along with good, solid protective factors. So let's jump in and see what some of that looks like. So this is from an article called All About Loneliness that just had some really practical good tips. One, acknowledge it. Like that sometimes for folks is a huge part of the battle, is just realizing this is what's going on for me. I have a few women clients that I see who have gone through a recent divorce and they're feeling very alone and isolated, but they didn't see it like that. They saw it as there was something wrong with them, they're overwhelmed, all the things, but they didn't narrow it down to, what, I feel a total lack of social connection. I'm busy with the kids all day and work all day, and I'm not connecting with anyone in a kind of a heart-to-heart connection. So acknowledging that this is about loneliness, this is about isolation, and this is about lack of social connection. Oh, I got a question. Are there studies differentiating between loneliness and grief? Oh my gosh, I'm sure there are. I don't know of any, but I would say loneliness is definitely, um, a product of, or a byproduct of grief and loss. I mean, they really go hand in hand. Good question. If anybody else knows if there are studies related to loneliness and grief, go ahead and throw them into uh, the chat. Practicing gratitude. It really helps us shift our focus and our attention onto what is really going well in our lives. What are we thankful for? What brings joy to our heart? So that practice of gratitude. I had met with a group of ladies and they were all probably, oh gosh, I want to say in their 80s. They lived rural. It was kind of like a widow group. So there was these five ladies and they got together regularly. Good for them, social connection, right? And many of them lived out rural, alone. And one of the ladies, we were talking about this topic, and she shared that she was in a place of feeling pretty low, and she's made it a habit that for an entire year, her goal was to do the 3 things I'm thankful for every morning, and she could not repeat them all year. So she was getting pretty darn specific, right? Like, I'm so thankful for these comfortable shoes that I can wear around the house. I'm so thankful for, just the very specific things that then that became her mindset. Her mindset wasn't on what was lacking or not going well. It was on, you know what? I'm so thankful for these blessings in my life. Next one is making time for our family and friends. And when we go back to thinking about those graphs where how much time was really had dropped off or was lost from 03 to 2020, we tend to really be committed to our work, and we tend to not be as committed to family and friends and social connection. And I mean, this hits home for me too, because I can tell people that my family is my priority. But if you were to look in my planner, it would not indicate that in my day-to-day schedules. So that's an intentional effort. Yes, Tammy, reinforcing it is okay to put yourself at the top of your to-do list. Exactly. Or even scheduling yourself or your family into your schedule. Like, that is okay. It is okay to do that. Next bullet point is get creative. And that really can be around, kind of goes with the next one too, embrace hobbies, but it's using your mind, your hands, your body to complete something or experience something that fills your soul. I have one client who she's not really active on the farming operation. Her husband is, they have no kids, live way out in the country. And so she purposefully has sought opportunities to learn how to play the guitar and take singing lessons. She has joined the local community pickleball group. She has become very active in her church organization, all very intentional things that are helping her. Not, I mean, some of it is making social connections, but some of it is just feeding her soul, even if it's something she's doing on her own. Getting outside, experiencing nature, volunteering or helping in the community. And that's really a dual blessing when you think about volunteering or helping, especially with other groups in your community that may be feeling lack of social connection. Not only does it help you, but it certainly helps them. And then seeking help. Is it time to go and talk through this with a counselor, a therapist, a mentor, a coach, a pastor, a priest, a doctor, to help you take the next step to get out of that place of isolation and loneliness? All right, other things before we move on. Other strategies that you have implemented to both prevent and or intervene when you are feeling socially disconnected, when you are feeling lonely or isolated. So this is the time for sharing. So go ahead and chat. Things that you've worked with your clients to do to either help prevent or intervene, or with yourself. And again, if you want it to be anonymous, you can just send it to me separately. So we'll pause here for a bit and let everybody put their intervention thinking caps on, right? So we can share. The best learning comes from us sharing with each other. Okay, Lorelai, we may need to reach out to neighbors and friends to invite them to lunch or coffee, but rejection is hard and it keeps us from doing it. That is so true. So the important thing to remember there is that we are only responsible for what we do. We're not responsible for the other's reaction. So if they say no, doesn't work for me, not interested, okay, you still did, you still lived by your value. You still reached out. Adding pets, that's huge. The connection we have, not the same as a connection with people, but it can definitely help with the loneliness. Thanks for that, Tracy. What else? What else works? Being intentional and setting goals, absolutely. This doesn't happen automatically. Our our ability to socially connect with other people is something that no one can do for us. And so, especially when people are struggling, when they're depressed, when they're feeling isolated, to put yourself out there and be intentional and do it is hard. But there are good, simple ways to do it. Even something like um, going to a community ed class, right? Just interacting, going to a faith community, going to some local meeting. Um, there's lots out there. What drives me the most crazy is when people say, there's nothing for us to do in our town or in our community. I'm like, oh my gosh, there's always things to do. You just need to seek them out and sometimes create them yourself, right? But I'm a big fan of rural. So whenever I hear that, I struggle with that statement. All right, Callie, question. Do you think people are just simply choosing not to do those things? They do not prioritize those things, or they don't realize how simple things like you listed can be so helpful. I think it's both. I think people in rural areas often tend to be a little more introverted. They tend to be a little bit more private. And so to reach out and become involved is uncomfortable. However, they are not necessarily making the connection to me reaching out and creating social connections is going to benefit me physically, mentally, behaviorally. Um, so I think it's a mix of what you're saying. I think it's underestimated the goodness of connecting with other people. And with social media, with our political climate, with all the things we listed earlier, with our weather, with financial struggles, all things that keep us kind of in our comfort zone of being alone, but it's eventually going to kind of catch up with us. Some people, they can roll with it. The majority of people need good heart-to-heart social connection. You're welcome. And if anybody else has thoughts on Callie's question, by all means, use the chat. Let's learn from each other. Okay. These are resources I used in the presentation. I especially want to call your attention to the top one because that is that Surgeon General's advisory on the healing effects of social connection and community. It's titled Our Epidemic of Loneliness and Isolation. And I'll send this out, but it's on the National Health and Human Services.gov website, or you could Google Surgeon General Social Connection Advisory.